Good evening and a warm welcome to all of you. It's fantastic to have you here for our second session in our online course on vaccine science. I'm Karen Young and I'm with the Center for Evidence-Based Healthcare at Stellenbosch University. And this online course is a collaborative effort between the Center for Evidence-Based Healthcare and Becky Caesar. So this is our second session. On Monday evening, we met and we covered the one-on-one on vaccine development. And it's give me great pleasure to introduce you to this evening's speaker, who's Dr. Richard Mihigo. He's the Director of Vaccines and Immunization Programs at the WHO Regional Office for Africa in Brazzaville in the Congo. Dr. Mihigo has been supporting WHO's response to COVID in the African region. But just before I hand over, I just want to remind all of you of housekeeping rules. So if everyone can please keep their microphone on mute and please switch your videos off for the duration of the presentation. We will start with a presentation by Dr. Mihigo, and following that, there will be opportunity for comments and questions, which you can pose in the chat. As the presentation goes along, you are welcome to start posting comments, and Anal Skunis from our team will keep track of those. So, Richard, over to you. Just a reminder, everybody else to please switch their videos off and keep the microphone on mute.
Yeah, thank you very much, Taryn, and good evening, dear participants, journalists. It's really a pleasure for me to take part in this session because I believe that this is a very critical moment we are going through, and we need more than ever the assistance of the journalists and the people in the media in general in conveying the right message to the population and helping really to debunk some of the misinformation that are currently going around. So I think we are going to spend an hour or an hour and a half, and I've prepared a few slides just to engage in this discussion. And hopefully we'll have enough time to have an interactive session where we can exchange our views and see at the end what could be as well your contribution in taking forward the COVID-19 vaccine deployment agenda forward. So as Taryn have said, my name is Richard Mihigo. I'm currently based in Brazzaville, Congo, where I'm speaking. So our regional office headquarters are based here in Brazzaville, Congo. As I've said, I'm in charge with immunization and vaccine development program for the WHO regional office for Africa. So today objective really, it's after the discussion I think you had yesterday in discussing the 101 for vaccine development. I think I'm going more to concentrate my talk for really the rollout, the COVID-19 vaccine rollout in the region, really to summarize what are the plan, expect the vaccine information, the prioritization of population, timing and the delivery. I'm not really going to go into very much detail because this is not necessarily the right audience, but bring some elements in these different topics on what role you can play as journalists to help us taking this forward. And then we will discuss the guidance on how to report on COVID-19. And I think this is quite a very, very critical in this time where we have so many misinformation and infodemic circulating. On the one hand, we have a very good social media penetration in many countries, but on the other hand, we are seeing countries using that approach, not necessarily for the good moving forward. And then I I put together a few materials that can help you while you are doing your work. So let me start by why the importance of having COVID-19 vaccine quality reports. I think, as we know, safe and effective vaccines remain our best bet, our best hope to bring this pandemic to an end. It was just a coincidence today. It's the first anniversary since WHO declared the pandemic as the COVID-19 as a global pandemic. We know that the issue of calling this a public health emergency of international concern were done end of January, but really we've spent 12 months, which was not easy to many extent, not only on our personal life, but also on the our family, our economies, our livelihood. And despite all the public health and social measures that has been put in place, which, by the way, are working quite very well, we have seen a great fatigue that has started to grow in the population. The barrier measures are not necessarily well implemented. And we believe that vaccines could help absolutely to be one of the critical tools which can bring this epidemic to an end. So the journalists play really a vital role in informing the public, not only on the science, but really on the important advances that can benefit health and of our community. And I would like to insist on this because we consider the media, the journalists, as partners in this particular fight against COVID. It's not by any means, there is a public health people on one hand, there's the journalists on the other hand, but I think we need absolutely to work together to convey the same message. Now, and I think as now we have started to see the rollout of the vaccine in many of our countries, I think it was really time now that Africa also start. I think it become even more important that a timely reporting become important. So let me first start by just recapping the basics of clinical development, approval, and safety monitoring for vaccines. I think probably you've gone through this process maybe yesterday. But we've heard a lot of things that have fueled the issue of misinformation, that these vaccines have been developed at a very, very high speed. How can we trust the vaccine? How can we be sure that these vaccines have been developed with the all quality? So I think it's important here to mention that there are many strict protection and regulation that was put in place, including really strong safety monitoring process to ensure that we can come up with a safe and effective vaccine. And for WHO, for instance, to provide an emergency use authorization, it has to make sure, we have to make sure that all the different steps for vaccine development are really observed. So most of the COVID vaccine that we are seeing now being rolled out have been evaluated through a very rigorous and most of the time multi-stage testing process that have involved tens of thousands of people, a broad range of the people from safe, people who have no condition to the people who have high risk. And most of these trials were designed really to detect and to identify any side event. So I think it's very important to mention this. However, we need also to add that the rapid development of this vaccine was possible mainly because of the two things. There was a huge scientific breakthrough that has led to development of new products using new platforms. that have never been used before. This is the case, for instance, of vaccine developed using the messenger RNA platform. But also we saw really a huge investment, not only from the private sector, but mainly from the public sector to finance this, because everybody needed the vaccine to end the epidemic. So as the vaccine are being introduced in our countries, I think close monitoring needs to take place to make sure that any side event, any unexpected adverse event that could have not been picked during the clinical trial are indeed detected. So, and I think such information is important because it will help to assess how the vaccine are going to perform in the real life. We can come back during the discussion about the, for instance, different clinical trials that have happened in our region, including, for instance, in South Africa, but also in other countries in Africa. So making really the decision on which vaccine to introduce, I think it's very important because after the data are generated through clinical trial, now this data needs to go through a regulatory pathway to be approved, and it must be approved by the national regulatory authorities, or in the case where, like in the what we are currently in the pandemic, where maybe national regulatory authorities might not have the bandwidth, the technical bandwidth to assess this vaccine, WHO has put in place a reliance process where our pre-qualification team can use the emergency use listing process for approving the vaccine. I would like to insist here that the emergency use listing process for emergency approval of the vaccine, it's not a regular pre-qualification process, but it's a process that after thorough evaluation of available data on safety, efficacy of the vaccine, the team come with the conclusion that this vaccine are now be safe and can be rolled out, particularly when we are in the emergency mode. But that's not enough. Once the vaccine has been approved or provided an authorization for emergency use, the National Immunization Technical Advisory Group, which are independent groups that are working in the country, needs now to meet together to review the evidence and then to provide the recommendation for policy use at national level. Before moving further, I wanted just to recap this slide because I believe it's quite very important in terms of understanding the how vaccine works, how the vaccine people are protected. And it's just a general slide talking about immune response to viral infections. So the body, the human system, to speak the normal language, the human immune system is something that helps individual. So I'm sorry, I'm going to put my video off because of my bandwidth, but I hope you can continue to hear me, and I will open the video when we start the discussion. Thank you. So I was saying that the immune system, so it's the body's natural ability to defend itself against the pathogen. So this could be viruses, could be bacteria, could be parasites, etc., and resist infection. So we have usually two types of immunity. That could be an innate immunity, which really most of the time is our first line of defense. When we get in touch with a vector, being a virus, being a bacteria, our organism really reacts against that. And there is a general reaction that will help to secrete some protein, which will help to defend the body against the outside infection. Now, the adaptive immunity, which usually is something that will come a bit later, after the body has entered into contact with the virus or the bacteria, and then will definitely involve some sort of either a cellular response or a antibody response. And here we have what usually we call the B cells or T cells. And that is very important to understand how vaccine will work later and for how long vaccine will continue to protect ourselves. So here I've tried to schematize very in a simple manner how when we enter into contact with a virus or a bacteria, how our body will react. So there is the incubation period that varies from virus to virus, bacteria to bacteria. And during that incubation period, the organism starts to mount the its defense against the organism before even the symptoms for that particular disease appear. So you can see now that the inmate's immune response starts really at the onset, even before the symptoms appears. And this is the ability of the body, the organism, to start to generate the some protein to react against that external aggression that is coming. And you could see that when the virus start to become detectable or the pathogen within the blood or the organism, this is where the symptom will start to appear. And at the same time, you see that the second part of the defense, what I call the adaptive immunity, kick in a little bit late. You will see the cellular response that will start very late, and you will see the antibody and being the IgM or IgG starting to come later. Now, what is the implication of all of this? To put it in a very simple manner, if we convert this for COVID-19, this is how we need to understand why some people who are asymptomatic, who are have not yet developed any sign of the disease, are very dangerous and can continue to spread the disease. So you see very well that on this blue bar, which is a high peak of, on virus when it becomes detectable, the viral loads increase suddenly in the organism before the onset of the symptoms. And this is the period where when you do a molecular test, being a PCR test or a rapid antigen, rapid diagnostic test, you can start to detect the virus. Whereby if you do it before, when the body, the person is still in an incubation period and where the virus load is still very low, the person can test negative to the disease, but still continuing effective and can pass the disease to another person. So the understanding of all of this graphic will preclude how vaccination will happen in the future and how our protective public health measures were devised. So how to prevent people, even those who are symptomatic, who needs also to observe the public health measures. Now, what are we doing to prepare for COVID-19 vaccine? So I won't spend much time on this because these are the technical things that countries are currently doing. So we are supporting countries really to put in place different and to take different steps to make sure that they are ready when the vaccine become available. The first step countries are going through, as any vaccination campaign, any vaccination drive, to put together a national plan to deploy the vaccine, to make sure that all the regulatory processes are in place so that the vaccine can be assessed and eventually authorized to be used in the country, even if the vaccine have been, national regulatory can rely on the recommendation that is made by WHO using the emergency use listing process. Then country did a lot of work to, after the development of the plan, to train the healthcare workers. And I must admit here that the experience of many countries in deploying vaccines, being measles, polio, is helping a lot to prepare for the rollout of the vaccine. Because these vaccines are coming with different features, different cold chain requirements, it's very important that country put in place a mechanism to really assess the readiness in terms of the cold chain and the supply chain in general. Country worked and spent a lot of time promoting vaccine through education. And I think this is where the media, the journalists really need to play a critical role, working with the community, working with the local authorities to make sure that the right message are passing and the right communication is being conveyed to the people, as well as guidance and put in place a monitoring system. Now, before we move further, I would like here just to say, okay, and try to summarize in one slide to clarify what we know for the moment and what we don't know yet. And I would like to insist on this because when you are communicating with the external world, I think it's very important that we become clear, honest in our communication with the community, so that information where we have data, we have evidence, we convey that information. Where we don't have enough information, enough data, we recognize also that. So what we know for the moment, clearly getting vaccinated against COVID-19 is a very important new way to protect yourself against the disease. Not only long-term illness, but also death. And the good news is that from the effectiveness studies that are starting now to be available, we clearly see that most of the vaccine have had a very high efficacy in protecting severe disease and hospitalization, and ultimately preventing death. And by the way, this is what is the major objective of any vaccination program, to prevent severe disease, to prevent hospitalization, and that evidence is increasingly out that these vaccines are doing that. The COVID vaccine, of course, like other vaccine, will cause some side effects. And most of these side effects, adverse events, are mild and temporary, and will definitely not require medical attention. The data that I consulted this afternoon before around the globe, close to 320 million COVID-19 doses have been administered. And it's very reassuring to see that there have been very, very few severe adverse events after the administration of more than 300 million of doses. These vaccines are very safe, are effective. Different vaccines may be available in different places throughout the country or around the world. And we are seeing many countries deploying several vaccines at the same time in the same place. Where we are still gathering evidence, it's whether people who get vaccinated for COVID will be less likely to pass the virus to other people. So this is something that data is still being collected to see what is the effect of vaccine in preventing transmission. We have strong evidence now that the vaccine are preventing disease particularly severe disease and hospitalization and death. Evidence is currently being collected on prevention of transmission. Secondly, how long the protection will last. I think it's quite too early. I think we have 3 months only with the deployment of this vaccine in many places. And how quickly COVID could help to bring the pandemic under control. We don't know yet. What is for sure, if we vaccinate many people at the same time, we could get to a process of herd immunity, which will be a collective immunity. But we know very well that the advent of new variants is coming to complicate all of this. So while the vaccine are a very important tool in preventing severe disease hospitalization, and we are starting to see clear evidence that even for countries that have immunized many people, the cases are dropping dramatically because people cannot pass the disease to anyone else. So probably we are going to see more evidence on the transmissibility of the disease. Now, let me move to the next few minutes on the safe delivery of vaccine and particularly AFI monitoring, because this is where usually we get a lot of problems. When there is one side effect, the media picked it, blow it up, and then this can affect the confidence of the people in vaccination. So these vaccines are being administered usually in the deltoid muscles on the arm. And we have seen a quite very innovative approach in countries that are using 2 different vaccines at the same time, where, for instance, Pfizer vaccine is given on your right hand and AstraZeneca on the left hand, so that people, when they will come to receive the second doses, people can tell them, okay, where did you receive the vaccine? If it's on your hand left, it's that vaccine. If it's on left, right, it's that vaccine. So, but basically, this is where it has to be done. So the skin needs to be clean. We show on this picture how vaccination will be done. Hopefully, we are not going to turn all of you in vaccinators. But what is important now here to talk to is monitoring of adverse event following immunization. So what is the AFI? I think we will hear more this in this presentation. It's any untoward medical occurrence following immunization. It does not necessarily have to be a relationship between the vaccine and the reaction, and we will see later on. This could be coincidental, this could be necessarily linked to the product itself, or else something different. So it could be an unfavorable symptom about which a vaccine recipient complains, which we should not neglect that, or abnormal laboratory findings in terms of the biology that are changing in the blood, etc. So some of the known AFI, adverse event following immunization, could be the pain at the injection sites, fatigue, joint pain, small fever, nausea. So usually these are something that are normal, and without most of the time any medication, they will pass by in the next couple of hours or days after the injection. It is the reflection of or the consequence of the internal immune system that is trying to fight this external agent and to produce, you know, the antibodies, and that the body reacts usually out of this reaction. So most of the time, these are normal things that can also pass very quickly. So some of the possible cause of these AFI could be either vaccine product related, an error in the immunization, or a coincidental event. So I'm not going to spend much time on this. So it could be the vaccine itself, which is most of the time, it's very rare event. And this is why it's quite important during clinical trial that a robust safety monitoring process is put in place. And as you probably have discussed yesterday, when you looked at the different clinical trial stages, I think we go very progressively with few people. Once we have reassured that there is no major issue in terms of safety, then we move to a much larger group, etc. So it could be also an immunization era-related reaction. That could be caused by inappropriate vaccine handling or prescription or administration. So we have seen that in the past, where in a one health facility, vaccine are kept with, for instance, diluent of the vaccine, and the diluent could be mixed with other similar vials. So people could mix things and then create a problem. And there could be just coincidental event. Someone was sick, he got vaccine, and then he developed a high fever, but that high fever is not necessarily linked to the vaccine itself, because the person was in an incubation period and then developed the disease. So these are some of the tips that we are going to give. I'm not going to spend much time on this, because these are mainly for people who are administering the vaccine. And once the vaccine has been used, it has to be the syringes disposed safely. And in most of the immunization program are using this, what we call the safety boxes. So in terms of the surveillance of COVID-19 vaccination, it's very important that any event that is happening be documented accurately. The detail of the vaccine, because we are now in a situation where in many countries we have 2 or 3 vaccines circulating at the same time in the country. So this is where the people, when there is an investigation to try to understand what is the issue with an adverse event following immunization, some of these elements are quite very important to understand what was the diluent that was used, if this vaccine has to be reconstituted, the batch number, so that we can trace this product up to when it was manufactured. It's important also to gather information to the vaccine recipient, including the address, the contact details, and etc. And all of that will help in the investigation process, because it will help to improve and then not necessarily to rule out any vaccine-related side event, but mainly to make sure that if an investigation has been made, the causality association process is done rigorously to rule out any problem that could be linked to the vaccine itself, and that will help to improve the product, but mainly also to make sure that the communication with the community is managed accurately. Now, let me move to this now part of the presentation around communication, social media, and then I will end up by discussing how information can be reported accurately. So I think it's very important in terms of the communication when a new vaccine is introduced, that there will likely be some public concern. What is this new product? Why has it been developed so quickly? We heard a lot of theories. Why do we want to introduce it in Africa? Why can't we start in elsewhere? The disease is not that predominant in Africa, etc. So it generates some concern, which is genuine concern that we need absolutely to address by putting in place a proper communication channels and relying on trusted sources where the right information can be provided to the community. Now, if this part is not very well managed, this is what usually creates or generates this misinformation and misunderstanding. So at WHO, we really are very, very, I mean, we take care of about this very carefully, because we know very well that if the communication is not very well done, it can be very damaging for the program. So transparency, giving the right information, it's really very key. And this is why in the process of rolling out the vaccine, early community engagement and communication will be really important. And from this, we need to listen. We need to listen and understand what are the concerns from the community. To understand what people feeling, what they know, what they don't know, as I presented in the slide before. And also, often, we tend to come up with a one-size-fits-all approach in terms of communication and discussion. And I think it's quite important that when we are communicating and passing, and I'm sure you are very best placed than me to say this, when you discuss with people, when we communicate in the local language, in the language that's in the terms that people can understand, things become much easier for the people to manage. And one important thing, and this is why I insisted on the transparency, I think we need to manage expectation. To expect, really to explain that the vaccine is not going to be available to everyone in every stage, or it's going to save everything. So we need to talk not only the process of rolling out the vaccine, who is going to get it first, and etc. What could be the limitation using that vaccine? And then what additional role that the community could play. So in line with that, I think it's important to track and address any vaccine hesitancy cluster that we see appearing. So at the end, maybe I will give you a information related to the Africa Infodemic Alliance that was created by WHO and many partners. And I'm sure many of you may be already been aware, to see how we can track this misinformation, how we can help working with the media to address this. So conducting social listening, try to go to the community. It's very important to understand what are the perception, what is being discussed during the social media. How are we using these findings to craft the messages? So we cannot address the issue of the community if we don't know what they are thinking. And when there is an issue, how do we put in place a crisis communication plan so that we make sure that countries are very well prepared to respond fast, to respond in a coordinated manner to any rumors, and particularly when there is an adverse event following immunization, how do we handle that? How do we conduct very quickly an investigation following the different steps I described before to rule out the causes that could be linked to the vaccine itself versus those could be linked to coincidence of mishandling of the product itself. And more often, we tend to see people who are not necessarily trained on how to communicate or how to pass the message being sent to discuss with the community, the public, or even talk to the journalists. And that could be very dangerous because people could be speaking out of their mind and provide the wrong information. So some of the frequently asked questions that we have seen, for instance, and I'm sure you are very familiar with these: how does the vaccine work? Can the vaccine cause COVID infection? We've heard a lot of issue around the AstraZeneca vaccine with the variant, particularly around South African country. Around that, do these vaccine alter our DNA, particularly for vaccine using messenger RNA, etc. So for all of these questions that community asks, it's very important that we come up with very simple but evidence-based response so that we can continue to build the trust and the confidence of the public. Now, I will conclude this presentation by now discussing a bit in detail what is our expectation in terms of reporting on COVID-19 vaccines. So I think some of, I believe, key principle on reporting on COVID-19 vaccine, and this is beyond COVID-19 vaccine, is to report more generally on vaccine. I think number one, we need, and I hope that our reporting is going to reinforce some of the vaccination norms. So we need to consider how, as a journalist, your report can help to encourage trust in safe and effective vaccine and reinforce vaccination norms. We know very well that for the moment, the issue of sensationalism or breaking news, when we have one small adverse event, it will attract media attention more than 100,000 people who have been immunized, who are now protected, are safe. But if we have one small side event, by default, journalists tend to report very quickly about that and then blow it probably out of proportion. So we'd like really to see how your reporting is going to reinforce the vaccination law. To remind the people the benefit of immunization. So emphasize that vaccines, COVID-19 vaccine, but beyond that, all the vaccine can prevent long-term illness and death from the virus or the bacteria. I think I insisted on this at the beginning. I think one of the objectives of this vaccination is to make sure that our ICU units are empty. We can limit the number of people who are getting severely sick. We can limit the number of people who are hospitalized so that the health system can continue to take care of other people. To inform the audience about the importance of the vaccine. But something important, probably you know better than me, we need really to use very clear, audience-friendly language. I think most of the time, particularly we in the public health, we tend to be jargonic, to use the very technical words. I think for the journalists, it's very important that you frame the scientific language through explanation with very simplified terms. And then to avoid the jargon and define scientific term in every article. When we talked about something, we need clearly to define that. But reporting is not necessarily to hide the information. And I think we have insisted on transparency, but we need to disclose the potentially side effects in a very responsible manner. We need clearly to state, you as journalists, what are the possible side effects to inform the public, to ease their reservation, but also to understand that some mild allergic reaction are to be expected. And I think we discussed that before, and not jump very quickly to the conclusion. So whenever there is side effect, I think we need to ask ourselves, as a people from the media, as people are communicating, is this information going to help people or is going to create more damage than good? So I'm not saying that things should not be reported, but it has to be reported in a very responsive manner. And particularly when we see that there is a strong misinformation, vaccine hesitancy, I think it's very important that to highlight the review process that has involved the COVID-19 to make sure that these are products that can be trusted, that are safe and efficacious. And more important, to report facts and figures about the role of effective vaccine in ending this pandemic. So it's important that we use the data, the facts in the reporting process. So, and most of the time, we see that people don't take enough time to read the scientific paper or even the report that are getting out. So with regard to the clinical trial, when we see, for instance, a vaccine has 60, 70, 80, 90% efficacy, we jump on one single digit number and then we publish it without understanding the context in which that efficacy data or things has been generated. So the advice here will be always to read the full study and or report before covering it. Not because I heard in the radio that something, this vaccine is 40%, I'm writing about it. Go find the data, find the information, read carefully the study and the reports, so you can now report very clearly. Most of the time, we tend to rely on press release. Associated Press have said this, Agence France Presse have said this, Reuters have said this. I think as a scientific journalist, reporter, it's very important that you read the document yourself to understand all the things. What is also important is to use the trusted and reliable sources. Very important, WHO websites, academic websites, like we've heard today with this initiative. Consult experts' knowledge before to develop the story. And what is very important is to cite the source. If you are saying something, where this information came from. I think it's very important to put the source, because there the information become credible and someone can go and cross-check, but not just throw an information like that. To provide the data, I think it's very important that when we are reporting, particularly on clinical trial, it's very important that we really looked at the data and say, what's the data saying? What is the demographic in the clinical trials? And I would like here to give the example, and maybe we can discuss that during the Q&A session. If we looked at the situation in South Africa, for instance, and the study that we published on the effect of AstraZeneca on new variants, clearly we say, okay, the vaccine is not working. But when you read carefully the data that came from that small study, first of all, you understand that that small study only enrolled people with 30 years as a median age. So people were supposed to develop severe disease were not part of the trial. If we looked at the sample size, etc. So I think before interpreting the results, I think we need to look at all of these different elements, which will put things into perspective. And then when there is uncertainty, please, let's see how we can communicate the uncertainty. And I hope yesterday you discussed the issue of confidence interval. So once you have a large confidence interval, meaning you have a big uncertainty around a point estimate in terms of coverage, we need absolutely to put that into perspective. Now, I would like just here to put few pictures that we usually see in the media, and I've tried to say what can be done and what we believe might not be appropriate to do and will discourage the reporter to do. So use the appropriate photograph. The illustration, other visual, will help really to educate the public about the benefit of the vaccine, and will attract the sympathy and alleviate the fear. So we've tried here to show, for instance, a range of diverse people getting immunization, young people, older people, gender, different race, to show the benefit and advantage of that. But if we show a picture like this on your right-hand side, where someone is like fearing the things, it's not going to encourage anybody to come to seek for vaccination. So I think the more the visual we use, I think what usually they say one picture is more than, say a lot than 1,000 words. So let's use picture, let's use visuals that attract more positive message than something else. And I would like to end here by just putting in place these different information resources. But for the sake of time, I didn't put much, but we can add on this and share this slide with the organizer, where you can have more information on our topic. So thank you very much. Taryn, over to you. And that's the end of my presentation.
Thank you very much for your presentation and for highlighting various aspects. And I think for me, the most striking one towards the end of your presentation was that we all have a role to play in facilitating and supporting the vaccine rollout, and it's about that doing it together that is very important and critical. So we have some time to take questions. There's been quite a few questions coming through in the chat, so I'll hand over to Anal to summarize the first set of questions for you.
Hi. Good evening, everyone, and thank you very much, Dr. Richard. So the first three questions are as follows. The first one is from Ashton Mackenzie from Caxton Local Media in South Africa. The vaccine was developed at a rapid rate because it was needed. The financial support speeded up the process of making sure the vaccine was developed. So, does a huge amount of financial support or investment jeopardize the need for proper quality checks? And that's the first question. Secondly, from Boubaker Mali from Guinea, asking, when someone is vaccinated, we know that he does not develop the disease under normal conditions, but can he transmit the virus after he is vaccinated to other people? And then thirdly, Makgala Masateng from SABC News in South Africa is asking, have we had enough people with comorbidities included in clinical trials thus far? And how is their reaction to the vaccine? Do we have enough evidence that it is safe for people with comorbidities to get vaccinated? So just for ease of reference, I'm also just going to copy and paste these three questions in the chat for you, Dr. Richard.
Yeah, that will help. Yeah.
There you go. Over to you.
Okay, thank you very much. Well, thank you very much. Some of these issues maybe I alluded to during the presentation, maybe not in much detail. So the Ashton from the first question, did we have proper quality check? I think this is a very important question. And I would like really to take time to explain this. I think it's very important to understand that most of the time we tend to to think that because the vaccine were developed so rapidly that they are not safe, they are not, particularly the safety was the major concern. But we need to understand here that clearly a regular vaccine development process, which is a process that usually happen in stepwise manner. You start the clinical development of a candidate vaccine. Once you have had the proof of concept, you move to the clinical trial. And from the clinical trial, you start by clinical trial phase 1, to ensure that there is safety, there's no safety concern. You move to clinical trial phase 2, could be phase 2A, phase 2B, again, to reassure again that safety concerns are ruled out. And then you increase the number of people that you are enrolling in your clinical trial up to when you reach the third stage, where usually you have enough data that could help to seek for regulatory approval and etc. Once you get to that level, regulatory approval and etc., then the manufacturing process can now start from the things. What happened during this pandemic was, rather than having a stepwise approach, there was what we call a sequential approach. So while data were generated from clinical trial, there is an immense, I think, risk that was taken to start already to manufacture the vaccine while we were not yet sure that the vaccine is going even to make to the finishing line. And this is where, as you explained, not only there was a huge amount of resources that were invested, not only in clinical trial, but by starting to even produce the vaccine before even it become available, the final data. So some of these candidate vaccine, fortunately, went through all the process in parallel, and the data from the last phase of clinical trial came very robust data in terms of safety, the efficacy, which was reassuring, and the vaccine were already available to start to be rolled out. Unfortunately, we saw the situation on the vaccine candidates where the project were dropped out because during clinical trial, it was realized that either in terms of safety, there was some concern, or in terms of efficacy, there was no enough efficacy to consider moving forward. And in that case, this parallel process that took place, most of these projects failed because, and lost a lot of money because there was a bet that was taken to say, okay, if this vaccine gets to the finish line, then we'll have immediately products that will start to be delivered to the countries. So this is maybe the only things that is different from what we've seen in the past. But I would like here to clarify that in terms of the quality check, the proper quality check, most of the phase, to move from one phase to another, I think all the regulatory steps, all the proper quality check were done. And by the way, WHO cannot issue, will never issue an authorization for emergency use or for pre-qualification if there is not enough and robust data that is supporting the quality and efficacy, quality and safety of the vaccine. So I think it's very important here to reassure you, but also to reassure the public that this process that were taken followed exactly the same step, like in a normal clinical trial. The only difference is that it happened in parallel with the development of the vaccine at the same time the production which was starting. And it's very important also to mention that some of the new technology, particularly new platform that were used, being the messenger RNA, being the vaccine vector, viral vector vaccine, like the one of Johnson & Johnson, AstraZeneca. These are technology that were also used to produce the Ebola vaccine. So the platform was there. The idea for producing a vaccine was there. So it was easier not to start from scratch, but to try to think about the platform that was successful in developing other vaccine and then apply it to COVID. And it really generated good results in a very record time. But again, not at the expense of the quality. I think that's very, very important. Now, for the second question, when someone is vaccinated, can he transmit the disease? This is what I put on the slide, what we know and what we don't know yet. What we know, there is now more and more evidence, robust data, compelling data that is showing the efficacy of this vaccine in preventing severe disease and hospitalization, which is fantastic. But we have not yet have enough data to say, okay, someone who's have received the vaccine, can he get the vaccine and pass it? So I think this is something that we are still exploring. Scientists are still exploring. And the reason why we say, okay, even if you are vaccinated, people need to continue to observe the barrier precautions, wear a face mask, and etc. For sure, as time will pass by, we will generate more data where we'll have enough enough evidence on the effect of the vaccine on the transmissibility of the disease. But again, what is here very important to notice is that the disease really, the vaccine prevents severe cases, prevents hospitalization, and that is the ultimate goal where we are all looking at. So people with comorbidities, yes, in large clinical trials, even some of which enrolled people in South Africa, all over the place. So a different age range were used. Young people, adult people, elderly people, people with comorbidities, and etc. And that's what clinical trial become important, because you want to understand what will be the effect of the vaccine in these different age group, in these different group of people with disease or comorbidity, etc. And one of the points, for instance, which was put forward very importantly, was we need to try this vaccine in Africa, because we will generate data from our own local ecosystem. For instance, people living with HIV, we need to understand how the vaccine are going to perform in those people. So clinical trial is very important. We need to seek clinical trial, not something like, but a step to generate data which are going to be even of benefit for ourselves. I will stop here. Over.
Thank you, Doctor. The next set of questions are about the AstraZeneca vaccine. First question is from Jemima Bekes from the Namibian Sun newspaper. She's asking, why the persistence around the AstraZeneca vaccine despite concerns about its efficacy? Then Kevin Brandt from Eyewitness News in South Africa is asking that South Africa was set to roll out the AstraZeneca vaccine through the WHO COVAX mechanism, but after the variant was discovered, this has now been scrapped. Which other COVID-19 vaccine through COVAX is now available for South Africa? And then Mia Malan from Bekisisa is saying that studies have shown that the AstraZeneca vaccine isn't effective against the new variant identified in South Africa. The variant has spread to most Southern Africa countries, yet some of those countries have received this AstraZeneca vaccines via COVAX. Why is that? I'll post them again in the chat.
Yeah, thank you. Very interesting question. And again, this is bringing us back to the slides that I've discussed. And again, the role and the responsibility of journalists when we are reporting on the data. So when we are saying that studies have shown that AstraZeneca is not effective, what are we talking about? Which study are we talking about? Etc. Did we take time to read the document, to understand what that document is saying? And here I'm talking about with you people from the media that you're conveying the message outside. So we need to understand what is behind the decision that are being taken and what the data, the science is telling us. So if I start by the first question of the colleague, the journalist from Namibia, why there is a persistence around using the AstraZeneca vaccine despite its inefficacy? I think that's not true. This is a very good vaccine. I think clinical trials have shown, and now we have even more data that are coming out now in terms of what we call vaccine effectiveness, the true performance of the vaccine when it's administered to many, many people. Clearly, the vaccine has shown, number one, when this vaccine is being administered with a different schedule than what was applied in the clinical trial, As you know, during the clinical trial, this vaccine was given in 2 doses, 4 weeks apart. But now we have more and more data, and the WHO Strategic Advisory Group of experts on immunization that met a few weeks ago went through all of these evidence. Now, and even the recommendation of WHO is saying that when you administer this vaccine, the recommendation is to give it the second dose 8 to 12 weeks after the first one. Because data now on the ground have shown that when you delay the second dose of the AstraZeneca vaccine, you increase the effectiveness of that vaccine. And we have seen efficacy that it's higher than what was reported during clinical trial. Secondly, more and more data now are starting to emerge. We have a large effectiveness study that have been published in the UK and Scotland that is showing literally the same effectiveness of AstraZeneca compared to the Pfizer vaccine in terms of preventing severe cases and hospitalization. And that's even against what we call the Kent variant, which is the variant that was first discovered in the UK. So we cannot say that this is vaccine that is not which is lack efficacy. Now, when we talk now about the study that have shown that this vaccine is not working in the variant that was first reported in South Africa, again, this is where the role of a reporter becomes important. Did you go through that the data that came from that particular study? What that study is telling us? So the study in South Africa was looking at the efficacy of the vaccine, of course, against any form of severity of the AstraZeneca. But when we looked at the people who were enrolled in that particular study, most of them being young, clearly it was shown that, and we need to report in terms of the fact that the vaccine didn't perform well in preventing mild to moderate cases for COVID-19 when people are infected by the new variant. However, what is very important, number one, when we looked at confidence interval for this data, these confidence intervals are wide enough and range from minus something to 50. So the chance of being protected is from 0 to 50. So when we talked about the confidence interval, it's a very important parameter that we need absolutely to consider. Secondly, when we looked at the limitation of that study with small sample size, which did not enroll people with who could potentially do severe disease, elderly people. So it became very difficult to conclude. Now, the government decided to postpone, to put on hold the use of this vaccine. I can understand that. It could be a wise decision. But what is the next step? It's to generate data from this particular continent on how this vaccine is performing against severe cases, in preventing severe cases and hospitalization, even in the presence of variant. Now, looking at the same platform that we used to develop this vaccine, which is, by the way, the same platform that we use for the J&J vaccine, which is currently being used in South Africa. It is the same vaccine, literally. Because the J&J vaccine had a sample size which was much larger, had enrolled a much more wider group, we saw a different figures in terms of efficacy for that vaccine. So it is, and it's important here to mention that to state what we know and what we don't know. What we don't know is how this vaccine is going to perform in the presence of the variant to prevent severe cases. And before we get robust data, we cannot conclude that this vaccine is not working to prevent that. So I think that's what the data is telling us. This is what the science is telling us. So when we are reporting against that, we need to talk about what the paper is saying, what the data is saying. So COVAX facility is not pushing this vaccine where vaccine is not working. That's not the case. COVAX facility and other countries are using this vaccine because of the data that is available there that's showing that this vaccine is indeed working. This effectiveness data that are starting now to come are showing that even in the presence of the Kent variant, the so-called variant from UK, it's working. So we need just ourselves also to generate data that is going to show the importance of that. And I will conclude by two things. The neutralizing antibodies that were generated after the infection by the new variant were completely down in terms of responding to the new variants, which is something that now we have data on that. But what we have seen even in that small study in South Africa, the cellular response, the T cell, the cellular response remained very high, even in the people who received the vaccine. So the response to a vaccine is not necessarily linked to the antibody response only. It is a combination of antibody response with cellular response to protect someone or not. So in conclusion, I would say that again, this is a very good illustration on how we should be reporting such data. We need to do our own homework. We need to read the papers. And I think you know very well that there are specialized journalists now who are very specialized in political affairs, very specialized in sports, very specialized in music. And we will, and I would like to thank the team at Bekis and the University here at BITS to put in place such forum, because we would like to educate the journalists in the public health domain as well, so that we give you hints when something is published. What can you do to go to look for the information, to dig in, to understand what is the issue before reporting on something? Over.
Thank you, Dr. Richard. So the next question actually ties in very well with what you now last said. That comes from Chidera from Darling FM in Nigeria, asking, how do we as journalists allay the fears of the people, especially as the news of Denmark's suspension of the AstraZeneca saturates the airwave? Maybe you have spoken now a lot on the AstraZeneca vaccine, but maybe just in terms of how can journalists help to manage the fears of the public in terms of the vaccines? So that's the one question. And the second question comes from Effie from Zambia National Broadcasting, asking also about what is your comment on Denmark's decision to temporarily halt the use of the Oxford AstraZeneca vaccine as a precaution after there were reports of a small number of blood clots and one death? So yeah, I do realize that you might have answered these already, so we can just go quickly through them. And then Leon from Kenya, from the National Media Group in Kenya, is asking, or is saying that he spoke to a number of Kenyans because they started rolling out the AstraZeneca vaccine last week. And the nurses at the national hospital have been advised to not speak to journalists about the side effects. So he's asking whether WHO advised the government to do so.
Okay. Well, I think if I start by the first question on how do we alleviate the fear of the public, and you are right, I think we should not only concentrate on the AstraZeneca. I think it's all the vaccines, by the way. We've heard a lot of rumors with the vaccine that are currently being developed using the messenger RNA platform. We've heard all this news that people are going to receive chips in their things, microchips and etc. So I think once again, we know very well that such rumors, such misinformation are being spread by anti-vaccination group, and it's not new with COVID-19 vaccine. We have seen that even for other vaccine in the past. In the West, in particular, in the developed country, we have seen more and more a big anti-vaccination group growing, and taking the social media platform as way of disseminating their messages and etc. So I think, again, I'll go back to what I said before. I think how to alleviate the fear of the public. I think you as journalists, one of the more important things that you need to do is, first of all, to educate yourself through such forum, but also help to educate the public. So to alleviate the fear of the public, you need first to get yourself the right information, to be confident enough to put that information in the public domain. And this is what I put in some of these slides. We need to look and to work with trusted sites, to work with sources of information that are credible. Today, you can go on Google, you put something, you find all sort of information. We need to put a bit of discernation between what is true, what is not. And before getting to that conclusion, you need to do a bit of homework to search the trusted source, to make sure that there is a thorough process in analyzing the things. So I believe that one of the tactics or techniques that I usually discuss and tell the journalists, I consider the journalists as partners for health, in public health in general. And that brings us to the second question. We should not be afraid to talk to the journalists. We need to communicate with the journalists. And I think I mentioned it in one of the slides. We need to, when there is no something that is not going on well, we need to communicate it and not hide. Because when you hide, even if there is nothing to hide, people become suspicious. They're not saying anything because they're hiding something. I think there is nothing wrong to say, okay, I received the vaccine. I have some pains here. Yes, this is normal. This is something that's happened. This is something that is not a problem. It will go away, etc. So our position at WHO has always been to engage the media, to engage the journalists, to discuss with them, to provide the right information. And if you follow WHO, every Thursday, we do have a live press conference on COVID-19, where I think I intervene all the Thursday with our regional director, and we received all the questions. We speak about everything. And I think transparency is key when you are discussing things. We need to say what we know. We need to say what we don't know. So in terms of adverse event, I think we have put in place a robust pharmacovigilance system in all the countries to help them monitor that, make sure that if there is something, it is reported and investigation is being made to make sure that we can dissociate what is truly an adverse event or what it's not. Over.
Thank you very much for that. So we have only little time left, so I've collated a few questions. They've been asking whether antibody tests should be done before a person gets a vaccine. Because there is not vaccine stock in abundance, is it not wise or more cost effective to rather vaccinate those who do not yet have antibodies? Let's just do one at a time, Dr. Richard. So over to you.
Oh, okay. Well, no, I think there are two issues here to consider. The antibody tests, of course, is an indirect test that will tell you if you have been in contact with the virus in the past or not. So, and even though you have a positive antibody test, nothing prevents you, and we've seen already documented cases of people can have a second reinfection with the virus. So our immune response is not uniform throughout and in different people. It depends on many, many aspects. It depends on the viral load. It depends on your own precondition. And the way I'm going to react to an infection is going to be different from my neighbor to react to an infection. So even people who tested positive for antibody tests, we don't have enough information on what was the severity of their infection, etc. But what is for sure, research area that is currently being pursued is to say, okay, for the people who have already done the disease, should they be vaccinated with 2 doses or with 1 dose? For the moment, the evidence that we have, it's okay, we need to continue to give the 2 doses to the person because we don't know if really 1 dose will be enough to boost enough the immunity and etc. So the recommendation for the moment is no. Even if you have tested positive, you should absolutely get your vaccine jab in order to be fully protected. And we hope that in terms of availability, we are going to see more and more doses coming soon. But it's important that we keep to the level of where people who are high risk can get the vaccine first before others. Over.
Thank you. I think we may only have time for one more question from Esther Nakazi. She noted that in programs, you know, when you go for a vaccine, you need to give up your details and including your address. But most people in Africa do not have addresses. So is there a typical way of how this is being dealt with? Over to you.
Yeah. So I think this is a very practical question. I think I'm glad colleague has raised that. So why in the first place people are taking address and things like that? So I think we are in a process where we need to make sure that people are identified. If there is an adverse event following immunization, people can be traced very quickly. And if someone has got a reaction, we can trace the people who received the same batch of the vaccine, going to see if there is a problem, and etc. So that's the ideal situation in a normal situation. But nevertheless, we may end up by finding a situation exactly as was described, where there is no address, nothing. So I think it's not well, it's not the end of the day, the world, but I think the ideal situation is to know, and community healthcare workers usually do have that information, where we have a very well-organized network of community healthcare workers. They can help at least. And the other thing, that information could help when people will need to come back for their second dose. I think it will be important that people be reminded, message be sent, where possible, community health care workers can do door-to-door to sensitize people. And I think all of that can help to increase the compliance in terms of adherence to the vaccination. Over.
Thank you. Perhaps one last question with a quick answer. It boils down to whether WHO is doing something to help African countries prepare for the cold chains that are necessary for, especially like the Pfizer vaccine that requires extremely low temperatures for storage, and especially in rural areas.
Yeah, we definitely are doing a lot of work in that area. Remember that the Ebola vaccine that is currently being used in DRC, in Guinea, during the current outbreak for Ebola, it's a vaccine that also is being kept at minus 70, 80 degrees. So when we are talking about this new vaccine that require ultra cold chain, it's not new for few countries, let me be honest, for few countries in Africa. So we have most of the country around DRC used the Ebola vaccine by storing this vaccine in ultra cold chain equipment. Of course, this was not national vaccination campaign. So with that, I think country have gained a lot of experience in using that. Rwanda, for instance, has deployed both AstraZeneca and Pfizer vaccine, quite very successful, because they use the experience of Ebola vaccine, and Rwanda being a neighbor to DRC, did conduct vaccination campaign using the ultra cold chain. So we conducted an assessment on the capacity of countries with regards to ultra cold chain. So clearly, rural area, very remote area cannot afford such equipment. And I don't think that it's recommended to buy similar equipment and to disseminate it everywhere, which cannot be used in the future. I think we need to avoid these white elephant kind of things, building infrastructure that are not going to be used. However, we have seen in more than 15 countries that documented availability of ultra cold chain in urban centers. And we are thinking that these are the countries that could potentially introduce the Pfizer vaccine if it become available in urban centers, whereby the other vaccines, being AstraZeneca, being Johnson & Johnson that is using one dose, or others, could be used in a remote area where cold chain is not a major impediment.
Thank you very much. That brings us to the end of the question and answer session. Professor Young, over to you.
So a big thank you, Dr. Mihigo, for joining us tonight, for your comprehensive presentation and for all the information that you've shared with us. This is really good in terms of expanding how one can all contribute. And again, for me, it strikes me how we can work together as researchers, journalists, and all the various healthcare workers and other role players to play a key role in terms of advancing the vaccine implementation. So a big thank you to you as our speaker. Thank you to all our participants. Just a reminder that we will be back on Monday evening at the same time. And next week, Monday, our session will be focusing on variants and the influence on vaccines. So we look forward to seeing you all on Monday evening. Enjoy the rest of tonight and the rest of the week. We will also try to see if there's any questions that we didn't manage to address, if we can send some comments and responses to those to you. So thank you everyone and good night.
Okay, all right, good night. Bye-bye.